Hi there, this is Dr. Habib. I wanted to go over a case study of mine of a patient who is dealing with the diagnosis of Hashimoto's, rheumatoid arthritis, high blood sugar, and some weight gain. Just a disclaimer before we begin, this case study is not intended to treat or diagnose. This information is provided by the Living Proof Institute and is not intended to replace the medical advice of your doctor or healthcare provider, and please consult your healthcare provider for advice about a specific medical condition. So Amy came into our office. She's 44 years old. She's a busy professional with a stressful job. She's actually a lawyer. And she was dealing with low energy, weight gain, and she was diagnosed with low thyroid function as well as rheumatoid arthritis. And she had some other genetic markers specifically for rheumatoid arthritis with no significant symptoms as yet. She was diagnosed with Hashimoto's, rheumatoid arthritis before any specific symptoms came into play. She had some significant trouble losing weight. She actually came in weighing 202 pounds, and she was also a borderline diabetic. She has a family history of type 2 diabetes, hypothyroidism, high blood pressure, and high cholesterol. Her goals when she came in were to maintain or achieve good health, lose weight, and deal with her hypothyroidism effectively. And her top three issues were hypothyroidism, rheumatoid arthritis, and inflammation. She had previously had treatment using levothyroxine, Plaquenil, which was for rheumatoid arthritis, and previously she was using Vimovo, a rheumatoid arthritis medication, as well as Ventolin for asthma, and various antibiotics for previous infections. Some little things that popped up during our initial appointment and during our initial intake was that she was having some irregular bowel movements. She also did have a past history of mild asthma, and she did have some antibiotic use in the past. And the other really important thing to keep in mind is that she had multiple autoimmune diagnoses. So not just one autoimmune condition, but multiple had been given to her during her treatment with her doctor. During our functional lab testing, we noticed a few very specific findings. First off, she did have some signs of insulin resistance as she was having trouble with her carbohydrate metabolism. As you'll notice here, a lactate marker was quite high, as was beta-hydroxybutyrate marker, which tells us that she was having some trouble using carbohydrate to produce energy, and that is a sign of insulin resistance. Secondly, she had some signs of mitochondrial dysfunction as well. She was having trouble producing energy overall, and that was occurring here at fumarate and malate markers below. In terms of her neurotransmitters, she was actually having some signs of low motivation and ability to handle the stress that she was under. So as I said, she was a lawyer and she had quite a bit of stress that she was under on a daily basis, and she was having trouble staying motivated and handling that stress every day. We did a stool test as well to determine exactly what was going on in her gut, and we found that she was low on some very important good bacteria, and she had very high levels of inflammation noted in her gut as well with her calprotectin marker. What we did for her was we made some dietary changes. We chose some whole foods. We added some probiotics to support her gut microbiome. We added certain supplements to support her metabolism. We improved her bedtime routine, which she did adhere to very well. And she increased her activity level slightly as well, just to make sure that she wasn't sitting all day and rather being able to be up and moving. And we also created a mindfulness practice, allowing her to be more capable to handle that stress that she was under on a daily basis. The outcomes from this was that she actually ended up losing about 50 pounds. She went from 202 to 152 pounds over a period of about 1 year. She had 3 separate reductions in the dosage of her levothyroxine by her medical doctor. She had minimal pain in her hands and her wrists, which was previously a little bit higher than we wanted to see. And her blood sugar levels significantly improved as well. And she also felt much more rested, had a lot more energy, and her digestion and bowel movements improved significantly. We were tracking her blood sugar outcomes, and we noticed that from January, her blood sugar levels were quite high. Her hemoglobin A1C marker was actually in the diabetic range at 6.0. And then following that in May, her blood sugar levels came down to a 5.4, which was much better. And then it actually came into the optimal zone by October, where her A1C was sitting at 5.2. So very, very good findings in terms of blood sugar changes. So if you're interested in taking the next step to feel your own best, to improve your own health, feel free to book a complimentary phone call with myself at speakwithdrhabib.com. You can join our Facebook group at www.lpicommunity.com, and you can register for our free 30-day program at www.30in30.org. I hope this has been enlightening, and I wish you all the best in your health.